Hey, it's Jessica Damasa with WTF Health, and I'm here at Giant Health with the man himself, Barry Shrier. He is the founder of Giant Health and also a serial entrepreneur. So Barry, pleasure to have you with us. Thank you so much for having me.
Thank you. I'm really great to have you on board, and welcome to Giant Health.
Okay, so welcome everybody to Giant Health, and give everyone who's watching a little bit of an overview about Giant, what it is that you guys are talking about here, and how this conference is different from all the other ones that are out there in the health innovation landscape.
Okay, well, welcome everybody, and really glad to have all of your fabulous viewers on board, and we hope you find this interesting and worthwhile. So your question was about the origins of Giant Health. So my background is as a tech entrepreneur, and I've launched and scaled and successfully exited from businesses in the telecom sector and the clean tech sector. And I had a really big exit years ago and vaguely thought about retirement, and then went back to the States to look after my father, who at the time was 91 years old, and helping my mother, who was 87 years old. And when you're looking after a 91-year-old, you're engaging really heavily with the healthcare sector, seeing doctors, nurses, visits to hospitals practically every day of the week. And I just madly fell in love with the healthcare industry.
Really? All of the flaws and everything, Barry, you fell in love with her, right?
Well, healthcare is about saving lives, reducing suffering, improving the quality of living. And my father lived until he was 92 years old because of healthcare. And I just said to myself, well, why am I retired? Why don't I add all my entrepreneurial experiences and ambitions to try and get involved in healthcare and to support the industry? So that was the origins of Giant.
So why do an event? Why not start up another startup?
Well, number one, there's lots of startups all around the world, here at Giant and all over Europe and all over the world, obviously. And number two, the message we get from big global corporates is that, by definition, they're really large organizations. They employ 50, 100, 200,000 people, so they struggle to be innovative. So we created Giant because the big corporates say we want to engage with the startups. We want to meet all these harebrained, crazy, mad scientists, tech innovators who are mortgaging their house to try and get their innovation off the ground. So Giant is a melting pot of all those big global corporates, the investors, the startup community, and we think that there's a big opportunity for us to help the industry via that mechanism.
So this is my first time at this conference, so I spent the day yesterday kind of scoping it out, and I sat in some sessions. Thank you. One of the things that I liked, I went through your program, and that really struck me as different with some of the different streams that you had. And so I like that in addition to like some of the traditional like tech type topics, like what a CIO should know or what a CTO should know, and like some of the health IT stuff. You also married in some of the more, I guess, sexy parts of the industry. So there's a whole session on blockchain, which is having you got to do that these days. But I like that you guys also included nutrition, and I like that you included cannabis as well, and medical marijuana. So talk to me about the decision to go that route with some of those, because I mean those are different types of innovations in healthcare. They may not necessarily be tech based. So talk to me about that. What was the decision there?
Sure. Well, GIANT is an acronym. It stands for Global Innovation and New Technology. And innovation, of course, happens at the fringes. It often doesn't happen necessarily in the innovation offices of big global companies. Also, there's challenges in healthcare relating to what they call the siloization of the industry. The silos. Every industry, people working in that industry work in silos.
Buzzword, though.
And exactly. I'll find some more buzzwords as well. And so as an example, if you're a pediatric orthopedic surgeon, you probably work in a very narrow area and you don't necessarily engage with all sorts of people outside the industry. But the cross-industry fertilization is very important. Every year we bring people, for example, from aerospace, or from last year we had a fashion show at our event. And you might say, well, why would you have a fashion show at a healthcare technology innovation event? And the answer is, the healthcare sector, of course, is cautious. It's slow-moving, it's heavily regulated, and that's good. I always like to joke that I'm glad my GP doesn't poke me with some widget she bought from a startup yesterday. So healthcare is cautious, it's slow, it's evidence-based, and other industries aren't so necessarily evidence-based or cautious, so they can innovate more quickly. So the fashion industry has been sticking computer microchips in garments for 10 years, and that doesn't even exist in hospital gowns yet. And therefore, we bring other industries and innovations in, which help to inform opportunities in healthcare tech and the whole healthcare industry. So that's one reason. And then if you like, I can elaborate further.
I was going to ask you, in hearing you talk about this, like, I want to know what you're excited about. So
Sure.
It's like, I mean, you got into this.
Some marijuana.
Well, I mean, if you'd like to talk about that.
Yes.
I mean, so yeah, I guess why bring in the cannabis conversation? I understand it's going to be the medical marijuana is approved for use here in the UK.
That's right.
Coming up relatively recently, or
Yes.
soon, actually, like next year, right?
That's right.
So, I mean, talk to me about that.
Okay, well, there's a lot of challenges in the global pharma industry. And of course, every big global pharma business talks about this concept, which they see as a very, very substantial risk to their business model. You hear about themes like beyond the pill, and how, for example, these days there's new evidence from very, very recent research about how things like maybe virtual reality technology could actually be deployed as pain relief. So if you're selling 3 or 4 billion euros of pain relief drugs a year, and that's at risk, then it's valuable for those people working in global pharma to come and learn about things like what's going on in immersive technology, which could actually replace drugs or partially replace drugs. And likewise with medical marijuana. Obviously a lot of evidence is coming together that that could be quite a valuable painkiller and also helpful in certain mental health conditions. And it's important that clinicians know about that. And we feel that Giant brings all these people together, including the not so orthodox concepts like medical marijuana, and that helps the industry.
No, I agree. I wanted to ask you, so last question for you. Just curious,
Okay.
I know, checking your watch.
Yeah.
So last question for you. So I'm curious to know, as like somebody who's come at this, like who did not have a career in healthcare to start out with, who got into this because of having to be a caregiver
Yes.
for their parents,
Yes,
and then
exactly.
has now like kind of curated a conversation here at Giant for the last 3 years. What do you think is what's hot and what's not from your perspective as far as like health innovation and technology is concerned? What do you think is hot? Give me some of that first, then we'll talk about what's not.
There's two really interesting challenges. Number one, of course, in every society, we have a lot of new healthcare concerns, diabetes and obesity and aging, and these are all becoming so much more expensive, aren't they,
Right.
for society? So tech innovation gives opportunities for clinicians to deliver more healthcare services, to achieve better healthcare outcomes at lower cost. However, you have to differentiate between the new, exciting, sparkly, shiny and the real world. And for example, in most state-run healthcare systems all around the world, doctors are scratching their heads saying, well, my desktop PC in the hospital is still running Windows XP. And you guys are talking about AI robots which are going to replace radiologists and things like that. Yeah, and CRISPR and things like that. So we're trying to cross those chasms of real world, real budgets, and how to actually help the medical industry, whilst, of course, supporting all the entrepreneurs who are creating amazing new innovations which you might not see on the market until 5 or 10 or 15 years from now.
Right.
So robotics is hot, of course, and we have autonomous robots here at Giant.
Wandering around.
And obviously all of the, the blockchain, the AI and things like that.
Anything not hot to you?
I'm not going to put my foot in that one.
Oh, all right, fine.
But we want to make sure that what is hot, like AI, stays hot. Gartner, of course, has said that AI is absolutely at the very top of the hype curve. But that doesn't mean it should perish from overhype. So every year we will always have lots of experts from around the world talking about AI and opportunities at Giant, whether it's hot or not. So what's hot or what's not is important, but also instead of getting stuck with this week's fashion, we want to keep bringing in a lot of variety and innovation which people might not have been aware of.
Fantastic. Well, Barry, it was so good to talk to you. Thank you so much for
Likewise.
talking to us about Giant
It's
and
a
kind of
pleasure.
the method behind the madness, so to speak. It's a pleasure.
And we're delighted to have you as an important and wonderful member of the Giant extended family.
Oh, thank you. I love being part of any extended family. Thank you. You're so sweet.
Thank you very much.
Barry, thanks so much. This is Jessica DeMassa. We got a round of applause, even for Barry, as we're speaking. This is Jessica DeMassa with WTF Health. Thanks for watching.